Hello everyone, welcome to my channel. Today I'm going to be talking about diabetic ketoacidosis. Where do we see DKA? So diabetic ketoacidosis is a condition that occurs in patients suffering with diabetes type 1. Okay, so what happens in DKA is the insulin is not produced by your body. Therefore, the cells cannot use glucose as energy. And then they look for an alternative source and they break down the fat into ketones, making your blood acidic. So, let me explain in detail for you guys. Okay. So, when we eat carbohydrates, what happens is we usually eat carbohydrates for energy, right? And our body breaks down these carbohydrates into sugar. So these carbohydrates are converted into sugar that goes into the blood. Okay. Now imagine a condition like, imagine that's a car. It's a funny looking car. So just think it's a car. So, and this is the tank. Okay. So we fill the tank so that the fuel will be used over time, right? Insulin is like the tank to let the fuel in. So what happens in patients suffering with type 1 diabetes is there is insulin cells cannot use glucose as energy. Okay, and then what will happen? The body needs an alternative source, and that alternative source comes from fat cells. Okay. So what is happening if the body does not get enough insulin? It needs the sugar that is, staying in the blood instead of being um, used. So therefore, body will not have energy. So it will look for alternative sources. So it will look for the fat cells where it will break down the fat and then it will leave the ketones in the blood and makes the blood acidic. So let me give you a review again. So when we eat carbohydrates, that is mainly to fill up for energy. Okay. What happens is the carbohydrates are converted into sugar that goes inside the blood. Example, when we fuel up our car, so that the fuel will be used when needed along the way. Insulin is that tank to let the fuel in. Okay, so patients suffering with type 1 diabetes who do not produce insulin, the doctor would usually prescribe insulin. Okay, and when things go wrong, so things can go wrong like if the patient skips taking the insulin, if the patient's equipment of taking the insulin is not functioning properly, or if the patient has any infection, then things might go wrong. And in that case, when the body does not get insulin, what will happen is it will look for energy from alternative sources, and it will look from fat cells first, and it will break down the fat into ketones, and then that ketone will enter the blood, therefore making the blood acidic. So what are the symptoms? So our body gives lot of warning signs. It's not like you end up in emergency right in one day. You need to watch for the symptoms very carefully. So first symptom is you might urinate more than normal. Second is you might feel thirsty. And that's happening because your body is diluting the unused sugar in the bloodstream in the water. And then your breathing rate might be higher. So it is a way where your body compensates for the acidic blood. And then you feel very tired and weak. So how do you diagnose this? So how do you diagnose DKA? By checking blood sugars regularly and also asking, you should tell your doctor very clearly that, you're having all these symptoms and therefore like you might want to look for ketones in the urine. So these are the ways. And how do we prevent DKA? By testing regularly as well as always taking insulin even when you are sick. Okay, so this is all about DKA. In case you have any questions, you can leave them in the comments below. And if you want me to make any specific topic that you're interested in, you can always reach out to me by letting me know which topic you're interested in the comments below. Thanks for watching. And in case you haven't subscribed to my channel yet, please subscribe. Thanks for watching.